I started using Restylane sub-Q till 2004. At the beginning, I started using with cannula, like how laboratory proposed, but I decided to perform different changes. Why using Restylane sub-Q with needle? Why this change? First, to make the technique easier. Second, to offer to the patients a treatment option with a minimum recovery time. Use the same injection technique that a normal common filler. I perform the procedure on the consulting room as any other treatment. I have, as you know, immediate and natural results. Patients can come back to work and social life, and of course minimize the discomfort of the patients. I'm aware that the tip of the needle is beveled, not blunt as the cannula, but always I say the same. With a slow and slow injection, that means with a careful technique, you shouldn't have any problem. I explained to you I have my experience with 23 needle gauge and 25 millimeter length. As you know, the beveled is cheap. For me, the ideal needle would be another one with the same thickness, more length in order to reach more area on the same injection, and of course a bullet tip in order to feel more comfortable doing the procedure. My treatment protocol is always the same. It means it's important to evaluate the patient and of course the area to be treated. Mark the area you want to treat. Take pictures, very important, before and after the procedure, and always frontal and as a profile pictures. Important, decide the amount total of product inject. Always depends the area you must treat. Maximum volume recommended per area is always depending the case, 2-4 milliliters per session. I like to perform the procedure step by step. Another change, I use topical anesthesia before the treatment. That means I recommend it to my patients, apply IMBLA, topical anesthesia, 30-60 minutes before the procedure. I avoid the local nerve anesthesia, and also I avoid the incision with blade. The procedure is very quickly, to maximum 15-20 minutes, that's all, you have the results. Always when I finish the procedure, I realize a gentle massage in the area in order to make sure that the implant is in the right place. Patients advise apply ice, avoid high temperatures, sleep on the back. Some colleagues say that it's not necessary, it's not important, always is recommended. And also I don't apply antibiotics after the procedure to my patients. And always I would like to follow up to control my patients to maximum 5 weeks in order to decide if more material is needed or to correct unevenness. The treatment can be done on the consulting room. That's very important for the comfort for the patient. With a minimum discomfort and a minimum pain for patients, patients can come back to work and social life. Side effects, however, you know from the same that in other procedures, in other implants, the same. For me, it's more important. It's important the natural and immediate results, and also the duration of the product. In my experience, I have patients that I inject 1 milliliter per site for a check augmentation, because they don't need more quantity, and really they come back 9 months later with nothing the product. Okay, and for me that's very important. As I explained to you, it's very important also to mark the area before the treatment. Always I perform the procedure, and how I explained to you in my private consult. I use a fan technique. It means placing small quantities of product or with a lineal and retrograde injection. I try to do the procedure with 1 or 2 injections, because you know that the needle is shorter in front of the cannula. That means it's necessary 1, 2, sometimes 3 injections to reach all the area. And as you know, sub-Q is placed supraperiosteally and under the muscle. In this case, I inject 1 milliliter per site. 1 milliliter per site. Frontal and lateral view. Here I present a male, then also he needs a malar augmentation. The procedure, as I explained to you, is doing by needle is necessary to have a careful technique in order to disturb minimally the patient. It's important to remark soft and slow injection, do the beveled tip, and I have both experience injecting women or men in different areas. Another thing that's necessary to say is it's important to stop injecting product before retiring the needle in order to avoid sure that the product is applied in the correct place. That means it's not it's not so superficially. That means you could notice a bump, and that means it's not a correct place to inject Restylane sub-Q. Patient's advice, I explained to you, gentle massage, ice, avoid high temperatures, sleep on the back, and no antibiotics after the treatment. Here, the frontal view, I inject 1 milliliter per side in this patient. Notice here the difference. As you know, the more frequent indication of Restylane sub-Q are cheek augmentation, also chin area, and another areas important and also interesting to treat are the nasolabial folds, as the colleagues explained to you, and surrounding areas in order to restore facial contour and to give volume. Treatment of the omega sign and surrounding areas is also important in order to have an harmony. This one is a maneuver that I think is important. I show you in the video. I pinch the area. That means pinching the area, I'm going to treat in order to avoid going directly into the periosteal, avoid any discomfort for the patient, and also I notice that this pinch distracts patients from the injection. Here I would like to share with you clinical cases. I treat both men and female of several age. This one is a young lady that he lost a lot of weight, and really with 1 milliliter per side of Restylane sub-Q has a very nice result. This one, there are the pictures after immediately the procedure. This one the same. Patient needs malar cheek augmentation. Here I use 2 milliliters per side. Notice the redness is possible like in other procedures. This one is a young boy. He needs 1 milliliter per side, also in the malar area, frontal and lateral view. This one is another interesting case because he wants to increase a little bit cheek augmentation, and also I decide to inject a little bit Restylane sub-Q in this area in order to have more harmony in his face. This one is one of my favorite cases because this patient noticed that really is the typical cheek augmentation. The patient arrives, it was the first visit. Normally in my first visit I don't like to perform the procedure. In order I like to explain the procedure, explain that it's necessary to apply anesthesia, that means understand all the procedure. Patient says, no doctor, I'm very sure I want to perform the procedure in this moment. Okay, go ahead. No anesthesia, no IMLA, no eyes, anything else. And the immediate result, and patient without any problem can come back to social life, and he feels very, very happy. Here I inject 2 milliliters per side. Notice a little bit redness, but anything important. This one is another patient. She needs really she presents a concavity of the malar area. That's true that she presents a very deeply nasolabial folds, but I thought we decide together initiate the procedure injecting Restylane sub-Q in this area, and then go with the nasolabial folds. Notice the difference. I just inject 1 milliliter per side. Then the patient she come back, sure she will need more. Here another patient, the same result, immediate result. This one is an old patient. Really, he needs more procedures. Really, the first indication was surgery, but he was some wedding and he was very excited to perform the procedure very quickly. We don't have time to inject or to visit in different to have more sessions, but he feels happy with the final result.
What was the volume?
Excuse me? 2 milliliters per site.
Each side?
Each site. 2 milliliters each site. Exactly. Sub-Q. I would like to control this patient. That means I would like to continue with this patient because it will be interesting to treat these wrinkles, like also the quality of skin, and in order to have to achieve a better result. But we don't have time. And the last patient I would like to present you. This one is she's a young lady. Really, she doesn't need cheek augmentation because she has a very nice cheeks. But when I was deciding what kind of treatment she needs, really at the beginning she wants just nasolabial fold. Okay, I say, okay, I'm agree with you, but notice here, you have here a concavity, and I decide to inject 1 milliliter per site, the Restylane Sub-Q, in order to cover all the area and to have more harmony. And then I inject 1 milliliter per site in the nasolabial fold. Okay? When I was doing the procedure, I explained to her that maybe when she comes back to the control, it will be necessary to inject Restylane Perlane in dermis medium, and means in order to cover all the face, all the wrinkle. That means the sandwich technique. Really, when she comes back to my office, it was not necessary. She feels very happy with the result, and me too. I would like to inject a little bit here, but she said me, no, doctor, I like. Okay, I don't touch. Okay, thank you very much.